Okay, well, I'd like to welcome everyone to this evening's webinar, the latest in our emotional well-being series and our wellness webinars. We're very delighted to have you here again this evening. I am Amy Leekman, President of NTM Info and Research. I will be your moderator and host for the evening. Today's topic is accepting reality to reduce suffering. Our speaker, once again, is Dr. Elizabeth Devon-Smith. Dr. Smith is a licensed clinical psychologist. Her professional background has involved researching and treating psychosocial and psychological factors unique to chronic illness and health concerns. She has worked in a variety of medical settings, including oncology, primary care, cardiology, pulmonology, infectious disease, sleep medicine, and NTM-related clinics. Currently, she is an assistant professor at National Jewish Health in Denver, Colorado. Dr. Smith, thank you for joining us once again. It's a pleasure to have you. Tonight, if you have questions, you can type them into the Q&A box. You have the option to send them anonymously. To send anonymously, you check the send anonymously box, and then once you've typed your question, you hit send. At the end of the webinar presentation, I will start reading the questions in the queue for Dr. Smith to answer. We'd like to thank our supporters, including Insmed, and we'd like to thank supporters like you. Without the support we've had from you over the last few years, we would not be able to bring you this wonderful programming, and it's been our pleasure to do so, and we look forward to doing so in the future. Don't forget to follow us on social media. You can find us on LinkedIn, Twitter, Facebook, and Instagram, and you can also find out more about our latest news by signing up for our newsletter at ntminfo.org. You can also catch up on all of our past webinars on our YouTube channel, youtube.com/NTMIR. We have an upcoming webinar in the wellness series on emotional well-being on Monday, November 28th at 7 p.m. Common sleep issues and how to get better sleep, which I think is something we could all use. We will probably also be announcing other upcoming webinars in the nutrition series, so stay tuned for that announcement. Dr. Smith, thank you so much for joining us. I'm turning this over to you. Welcome again.
Thank you so much, Amy. All right, I'm going to share my screen. You know if you see that okay?
Yes.
Perfect.
Yes,
okay. Well, I'd like to welcome everyone. Tonight, I'm going to talk about accepting reality and how that can reduce suffering. So on the surface, that sounds pretty simple, right? Just to accept reality, but it's actually a lot more challenging than it sounds. So I'll go through some different skills and tips that are involved in this set of skills. So specifically, I'm going to talk a bit about acceptance, what I mean by acceptance, what's included in that definition, and then a slightly different take on acceptance in some modalities of therapy is called radical acceptance. And so I'll talk a bit more about that as well. What different types of things in our lives need to be accepted, why accepting reality is important, the benefits of this, when to use these skills, and then how specifically to practice acceptance. Again, it sounds deceptively simple, but I think as we talk through this tonight, you'll realize it's a little bit more detailed than it sounds. So when we talk about acceptance, really we're talking about trying to avoid trying to change things that we have no control over, which can lead to expending a lot of energy on strategies that lead to dead ends. Acceptance is a voluntary action involving a stance of non-judgmental awareness. So really what that means is looking at situations and deciding that you're going to accept this situation, regardless of whether or not you like it. You're going to try to accept it in a way that doesn't bring about any judgment to yourself, to others, to the situation, and you're going to be aware of the present. So this can mean making room for uncomfortable emotions or experiences that can't be changed. That doesn't mean that it can never be changed or never be altered, but in this moment, there's nothing that can be changed about it. It's also important to note that we can't change the past necessarily, so that's another can be beneficial. So, you know, we don't have control necessarily over what has happened in the past, so accepting the past as it is can be beneficial. Acceptance is an action that we take on purpose, so it involves some skills and some effort. and you have to be willing to be present with whatever you're facing. And so that's one of the harder parts about acceptance, is is the willingness to face this instead of deny it or try to distract yourself or suppress anything that may come up along with that. And it also involves an awareness of the present. So being in the present moment, not so much being worried about the future or the past, but the here and now. So level of acceptance can vary from moment to moment. It's not something that's just achieved, all of a sudden you're now accepting everything or you're accepting reality as it is. It's something that takes continuous effort. And so you may be more accepting some days, less accepting other days, more accepting at certain times. It's definitely something that varies. And acceptance is described as an action, not a result. So it's not ever constant. Even if we more or less fully accept something, there is still some varying levels of this, especially if the topic or the situation is really emotionally difficult for us. Losing a loved one, our health, grief, a lot of that can vary. The acceptance level can vary moment to moment even. And so they describe acceptance like a stance that you try to adopt versus a posture that you maintain continuously. So you're trying to work yourself into this stance, knowing that you're not going to stay there forever. You can't maintain this stance forever, but you can come back to it. So acceptance really can free up a lot of time and a lot of energy that can be redirected to other aspects of your life that you might have more control over. In some ways, it's actually going to free up more time to make change to the thing that you're accepting. And I'll talk a little bit more about that in a bit. And so, like I said, radical acceptance is a different way of looking at acceptance. And so one way that you can think of radical acceptance is all the way. So it's not accepting something a little bit. It's not, kind of half accepting it, half not. It is total and complete acceptance of the facts of reality as they are. And so this is acknowledging that the facts are true and letting go of any sort of fight with reality. And so ultimately this can reduce suffering and increase the sense of freedom. So you want to accept life as it is in the moment, and it's a full mind and body acceptance. So it's not, we might logically know that we need to accept some things, but emotionally it's a completely different story. And so this is really coming to a point of acceptance with our minds, our bodies, what we do, what we're not doing. It's full acceptance is what radical acceptance entails. And so I always like to start here when talking about radical acceptance, because it actually can be a tricky topic to discuss accepting things that you might not like or things that might be difficult. And so I want to highlight what acceptance is not. So acceptance is not tolerance. Tolerance is a little bit different because when you're tolerating something, you're accepting it for a moment or on conditional terms. So it's like acceptance with strings attached. So you might be willing to accept pain or distress under certain conditions or up to a certain point. And so tolerance can be a start, but it's not really radical acceptance or even just acceptance. It's very conditional. So with tolerance, you're putting up with it, but not really doing the work to accept it. So this is different than tolerance. Acceptance is not approval. So that's a point that can be really challenging to work towards acceptance, is that acceptance can sometimes feel like you're approving of something. And it's very hard to accept things that we don't like. So I'll give you all an example. So if you think of someone that maybe someone that went to prison, let's say, for a life sentence for something, a crime they didn't commit. And so this individual's in prison for life for a crime they didn't commit. They used up all their appeals. They don't have any money left, any resources to hire a new legal team. So they're kind of out of options. So accepting that prison is their home for the time being is absolutely critical. And it's hard to do to accept where I'm in prison for life. Obviously, that would be a very challenging thing to do. But fighting the system, getting into arguments with the guards or trying to, kind of disrupt the system, or even just lying down on a cot and giving up, both are going to lead to consequences. So without acceptance, this individual can't adapt to life in prison, and it often leads to more suffering when you're not willing to accept something. So it doesn't mean that this individual has to approve or like being in prison, but that is reality as it is in that moment. And so accepting is not necessarily approval. It's also not resignation, passivity, giving up, or giving in. That's another thing that can be challenging with acceptance, is it feels like you're just throwing your hands up and saying, Mom, this is it, there's nothing else I can do. I have to just accept it. And that's actually not the case at all. It can feel like you're giving up or becoming passive and helpless, but really that's only going to happen if you also fail to accept these three different things here. So if you fail to accept that you dislike or disapprove of the situation, that there's a possibility for change, and that it's worth the time to try to change. So if you are accepting something that you don't like and you don't want to stay the same, you can still make change. Fighting reality actually can interfere with problem solving, because if you're fighting reality, you're not problem solving, you're just fighting the situation that can't be changed in that moment. So accepting can actually result in greater ability to reduce the source of pain, to make a change. Doesn't mean giving into a life of misery. It's not defeat. You're basically taking back control by accepting the reality as it is. I love examples. I think it makes it clear. So another example that I've learned when talking about acceptance is thinking about ordering something online and not getting what you ordered. So let's say you ordered a pair of shoes and they sent you the wrong size. So you can accept that you got the wrong size and it's going to start the problem solving, but you also have to accept that you don't want the size you got and that you want to put in the effort to correct the mistake, that you can correct the mistake. And so that'll propel you forward, calling customer service, getting the new size, getting the problem fixed. You first have to recognize, okay, I got the wrong size. You have to accept before you can make any sort of change. And that leads to the next point, is that acceptance is not against change. So it doesn't mean that you can't ever change a situation just because you accept it as it is in the moment. Acceptance alone doesn't change a difficult situation, but it makes more room for change, makes it more likely. So we have some power to change the future, but we can't change the fact of the past and this exact moment. So like the moment that you are hearing the words out of my mouth, you can't change this exact moment. You might be able to change the moments in the few seconds that are to come, but in this moment, you can't make a change. And so accepting the past in this exact moment also does come with a sense of not being able to change, but there are some elements to some situations that have the possibility of change. So acceptance is really a starting point that allows us to ask, okay, what's next? What do we do from here? Now that I am accepting X, Y, Z, where do I go from here? How do I want to make changes? If I can't make changes, what can I do? How do I adapt to this? How do I make a life worth living even with this pain in my life? So if you think of, from a health standpoint, accepting a diagnosis instead of denying or ignoring it is really critical to begin to learn how to adapt, to treat it, to make adjustments. First, you have to really face it and accept that this is what it is. And so what has to be accepted? Reality as it is. I've kind of said that. I've alluded to it already, but accepting reality as it is. And so the facts about the past and the present are the facts, even if you don't like them. This is where it can sound a little callous, like, well, it is what it is. Not run away from the problem, deny it, avoid it, ignore it. You're trying to face it and accept that reality is what it is. So, and another thing here that needs to be accepted is that there are limitations on the future for everyone. So it doesn't mean that you're limited in everything that you do, but everyone has some limitations. And so recognizing that limitations exist and accepting it can actually lead you to prepare for a more full life that you want. So I want to highlight here, though, only realistic limitations need to be accepted. So things that, if you have a broken leg, you're probably not going to hike 20 miles. That's a realistic limitation. Because you have a physical illness doesn't mean that you can never do anything again. That's not a real limitation. So that and highly likely limitations need to be accepted. So, it might be unlikely that you'll travel to space, but it's not totally unlikely that, you could travel out of state. So really, we don't want to get too prohibitive with these limitations, but just knowing that there are some limitations to our future. Everything has a cause. That's another valuable thing to accept. So this gets a little philosophical, but when you think of everything in your life having a cause, be it physical, psychological, spiritual, whatever, it starts to feel like you have more control over the situation. You're not falling into these traps of why me, or this shouldn't have happened, which is the opposite of acceptance. You're kind of realizing that, okay, this is happening. This has a reason that it's happening. I may not like the reason or have any control over the reason, but this is happening. This is what I'm accepting. An example that I like to think of with this is there's a example where I think a dog gets out of a yard and is running downhill in the middle of the street, going into an unmarked intersection with no stop sign as a car is approaching. The car is speeding, the driver's distracted, doesn't see the dog in time to stop. The car hits the dog dies. Should this have happened? Yes. I mean, that is a really hard thing to accept, but yes, it should have happened. If we're thinking from the there were causes for it to happen, right? The dog was running fast down a hill, unmarked intersection, a car speeding, distracted driver. There were a lot of causes for this happening. To say it shouldn't have happened would have to create causes for why it should not have happened. So this isn't saying that you liked that a dog got hit and killed. This is saying that it happened as it should have because of the causes behind it. We don't have to pinpoint the exact cause of everything. We don't have to know why exactly everything happened, but seeing that there were causes and things happened as we could expect them to happen. Again, it's not approval, it's acceptance, and it's not passivity. So a lot of, accepting that this happened as it could be expected to happen can actually lead to change, right? Leading to change the causes of what happened. So putting a stop sign in, maybe the dog owner changing a fence, it can propel this forward momentum, but first you have to accept that this happened and there were reasons it happened. And then another thing to be accepted is that life is worth living, even with pain or painful events in it. So you can still create a life worth living despite pain. There's pain for everyone to some degree. We cannot avoid pain, emotional, physical, in every sense of our lives. We can't avoid that. So knowing that life is going to be painful and that we can still have a life worth living is something that needs to be accepted in order for us to have that full life. So if we think back to that prison example, this person's in prison for life for a crime they didn't commit, no way of getting out in the near future. What are their options? They can't magically solve the problem and get out of jail. So what now? Miserable, upset, crying, yelling, all of that every day. Or they could accept that this is where they're at. It's not changing anytime soon, and figure out a way to build a life worth living in prison. So basically the person would be going from this unendurable agony to endurable pain. So accepting that you can build a life even in really unideal circumstances. There are still things you can do to even bring some positive to the negative. So I know that's a really extreme example, but chances are a lot higher that you're going to build this life that's worth living if you accept, the situation that you're in at that moment. So other aspects that can't be controlled and require acceptance, certain physical sensations, be it pain. Like I said, we can't avoid all pain. Doesn't mean that we have to, lay back and accept every pain, that comes along, but there is going to be discomfort and pain in our lives. So accepting that we can't always control that. An objective event or external stressor. So an example of this is a natural disaster, a pandemic. These are things that we can't necessarily control, to some degree. And it's something that just requires. One thing that's really important is that we can repeat behavior that needs to be accepted. We like to think that we can, but at the end of the day, we cannot control what other people do. We can make requests. We can ask someone not to do something, ask that they help us, ask that they do something differently. But ultimately, that's a request, and how they respond to that request isn't within our control. And so when you're working with someone asking for something, trying to get something you need from someone else, there has to be a certain level of acceptance that you can't control the outcome of that. There's a limit to what you can do. And then another aspect that can't be controlled and requires some acceptance are past events and personal history. So childhood trauma, childhood experiences, health conditions. These are not necessarily things about our past that we can control, and that often just need to be accepted. And that's pretty hard for people, especially if we're talking about very difficult childhood trauma. To learn to accept that happened to you is quite challenging, and it's something that requires a lot of effort, but it's possible. And again, it's not approval, it's not passivity, it's not saying that you're happy or glad this is happening, it's not forgiveness, it's acceptance of the facts as they are, or as they were. Why accept reality? So rejecting reality, it doesn't change it. So if we avoid, deny, resist, it might make us feel better briefly in the moment if we just try not to think about something, but it doesn't change the facts. It's still there. It's going to come back. It's not something we can avoid. Reality is what it is. Resistance and willpower alone, it's not going to change it. So there's some benefit just to facing reality and accepting it. Another reason to accept reality is changing reality requires first accepting reality. So I read this a while ago, but they described rejection of reality like a cloud that surrounds pain, and it interferes with our ability to see clearly. And so problems that are hard to see clearly are very difficult to solve. So refusing to accept certain things makes it pretty much impossible that we can solve an issue or make change. Again, I think I used this example already, but refusing to accept an illness or a health condition, it can lead people to avoid treatment, to avoid finding out information about it, to avoid planning for the future, which might cause even more difficulty, worsened health. So really accepting that diagnosis or that condition can help lead towards how to deal with it. I hit on this already, but pain can't be avoided entirely. So emotions, even painful ones, serve a purpose. I think I had another webinar that talked about difficult emotions, but every emotion has a purpose, evolutionarily speaking, and we can't always avoid the painful emotions. So if you think about, even physical pain, of touching like a hot stove, that causes a person to move their hand. It's adaptive in some sense. So pain is not always a bad thing, but sometimes it's something that we have to face. So trying to avoid pain isn't always realistic. Rejecting reality turns pain into suffering. So pain is basically the discomfort in response to an event that's distressing, but it's natural and it's healthy in the sense that it's expected. If you experience something difficult and distressing, there's going to be discomfort. And it's most natural and healthy when it's not suppressed or avoided, at least not indefinitely. Whereas suffering is when you have this pain and then you add in non-acceptance of the pain. So struggling to control something that can't be controlled in that moment, trying to eliminate it, trying to avoid the pain. Now you've turned this pain into suffering. And so rejecting reality can turn pain into suffering. And so that's a benefit of accepting reality, is not turning pain that's already going to be there into suffering. Can actually interfere with reducing pain in the long run as well. So, just because you don't face the pain now doesn't mean you won't face it later. And I mean pain like emotional distress and discomfort. Refusing to accept reality can keep you stuck. So accepting can actually free us up from some of these painful emotions or lessen the weight that they exert over our lives. So when we don't accept reality, a lot of times we're stuck there. We're not free from the suffering. We're not free from, the effort that it takes to keep us in this constant state of distraction or avoidance. Once you accept it, the efforts to ignore, or stop, or deny, or suppress the pain takes up a lot of energy that can now be freed up for other things once you accept. And then acceptance often leads to sadness. I mean, when you accept something you don't want or something that you wish was different, it's going to lead to sadness. There's going to be some sort of grieving response, but a calm usually follows. So I don't know if you've ever had the experience of even something mundane, just accepting, okay, like I'm going to be late for an appointment. There's no way around this. Stuck in traffic, I'm going to be late for an appointment. You might feel a little panicked at first, but eventually it's like, okay, like this is happening. This is what's going to happen. Like I'll deal with it. There's some calm that can come from just accepting that a situation is what it is. A lot of times it can help you feel ready to move on. When you accept something all the way, like if you accept that you lost a loved one, for instance, once you move into that acceptance, you're not going to stop feeling sad or missing a person necessarily, but you might be able to feel a bit more freedom to move on, to continue on with your own life. So when to use these acceptance skills? These are times when they're particularly helpful. So when life has dealt you a major trauma, pain, or difficulty, so I absolutely think chronic illness or health issues falls into this pain, difficulty, maybe even trauma. There is such a thing as medical trauma. And so accepting some of these things are going to be crucial for you to move forward and to get unstuck. So accepting things that maybe we did in the past that we regret, maybe not being treated well by family, maybe being abused, physical disabilities. All of these things are things that it's reality, and it requires some level of acceptance. Another useful time to use acceptance skills are when you're in distress, but not crisis. So when you're in crisis, which can be defined as like a highly stressful situation where there could be very negative outcomes, so like a relapse. Someone who's sober, let's say, is in a situation where they might relapse, they might drink again. It's not the time to work through acceptance. That's the time to deal with the crisis at hand. When there's short-term issues like urges to drink in this situation, when the distress is really extreme and overwhelming, like you just got bad news, you might not be willing to work towards that acceptance right away, and that's okay. But it can't be avoided forever, right? So there's a balance here of dealing with a crisis situation so that you can lower your distress and come to a place where you can work on that acceptance. So when a situation is painful and can't be changed in the moment, but it's not an immediate crisis. So absence of reality acceptance can make things worse, but acceptance can actually be soothing. So I think I already gave this example, but like waiting in traffic, knowing you're going to be late for an appointment, This isn't a crisis situation necessarily, hopefully not. But if you're fighting the reality of it, you're stuck in traffic, you can't move the car, 5 minutes to your appointment, and you're 20 minutes away, you're going to be late. But if you don't accept it, you're fighting it. Maybe you're, yelling at the other cars, you're panicking, you're speeding, you're doing everything you can to get there. Whereas if you just accept, hey, I'm going to be 15 minutes late, it can be somewhat calming. Even if you're unhappy that you're going to be late or if there's going to be consequences, not accepting that doesn't necessarily change it. It actually frees up space for you to problem solve. Okay, I'm going to be late. What do I need to do about it? Another time to use these acceptance skills when problem solving isn't working, and you may need to evaluate whether you're actually accepting all the facts of reality. So let's say that you're trying to problem solve going on a vacation. You had this trip planned, 2 days out, you get the flu. And you're trying to problem solve, how do I do this trip when I'm, pretty sick? So you go to the doctor, you get treatment, you're following all the treatment, but the night before your symptoms still haven't improved, you're not feeling well enough to travel. At this point, your problem solving to go on this trip probably isn't working. And so it might be a good time to accept the reality that you're sick and you can't travel. It's hard because you don't want to do that. You don't like it, but it's reality as it is. And accepting that leads you again to be able to problem solve effectively. So, instead of trying to problem solve, how do you go on this trip no matter what? Now you're problem solving, okay, I can't go on this trip. I'm not well enough to go on this trip. What now? So if you're problem solving and it's just not getting anywhere, there might be something in there that you're not accepting, that might be a barrier, that's a reality that could use some work towards. A quick note about accepting the facts of reality. I want to highlight that it's facts that we're working towards accepting. So you have to be really careful that we're not accepting distortions of the past. So an example, like I was bound to fail from the very start. That's probably a distortion. We can't say that for sure. Exaggerations, I never get what I need. Catastrophes, my whole life is ruined. Or other beliefs or assumptions that are not facts. So we only want to try to work to accept facts, which are observable and provable. So another example here is someone that stopped talking to you, that's a fact. So accepting that someone is no longer talking to you is worth accepting because that's reality as it is in that moment. But accepting that someone is a terrible person, they've decided they hated you, that's an opinion, or it's your interpretation of the situation. It's not the fact. That might be how you are interpreting what is happening, but what is happening is they're not talking to you. So you have to be really careful about that distinction, or else you end up trying to accept things that might be pretty painful and might be inaccurate. So some clues of distortion would be some of these extreme words like always, forever, never, need, should, must, can't, every time. That might indicate that there's some level of exaggeration or distortion to what you're trying to accept. And then you always want to check the facts. So just making sure that your description of the situation or event doesn't include any sort of interpretation or assumptions. So, with childhood trauma, for instance, someone might accept the fact that, their mother mistreated them when they were younger. Their mother yelled at them a lot. Their mother hit them, X, Y, Z. But they don't necessarily want to try to accept that my mother never loved me. My mother never cared about me. Again, not saying that that's not true, but it's not a fact. That's an interpretation or an opinion. So you have to be really, really cautious to look at it from this unbiased third-party viewpoint of what you're trying to accept. With chronic illness, maybe working to accept that I have this diagnosis, I can't function like I used to, those are things to accept. Whereas, my life is over, my life is ruined, that's not necessarily something that you need to work to accept. It's more the facts that you want to focus on. So I'll go through this example quickly because I do want to get to the skills and I want to leave time for questions. Actually, I'm going to skip it and we can always come back to it if we have time later, because like I said, I really want to get to the skills and then if there's any questions. So I like these images. I'm a visual person, so I think that this is helpful towards, understanding radical acceptance. But COVID-19, everyone experienced it that's in this webinar right now. So when we talk about radical acceptance for something like that, non-acceptance, is things like, why is this happening? I don't want this to be happening. This is making my life awful. I don't like this. I'm so stressed out. I'm shut inside my house. These are all things that might be true, but it's not really working towards acceptance. What's working towards acceptance is this is the situation. This is the pandemic. This is what's happening. People have different opinions on how the pandemic was handled, but whatever state you're living in when that was happening, there probably were certain restrictions, and there's some level of acceptance that has to come with that, whether or not you agree, whether or not you like it. Sometimes fighting the system can lead to more pain. It's not saying that you can't ever change the system, but in the moment, accepting something might be beneficial. Again, because then you can work towards change. So when we're talking about radical acceptance and chronic illness, looking at it like, I hate being sick. I wish I was normal. I'm always in pain and my life would be so much better if things weren't like this. My illness stops me from everything I want to do. Why can't it just stop? Why can't it be different? Things like that. That's coming from acceptance and be, okay, I have this chronic illness. This is how things are. I may not agree with it or like it, but refusing to accept my reality won't necessarily change it. This is where I'm at right now. It's the stance that we talk about with acceptance. And it's not necessarily weakness. Doesn't mean, again, you're giving up. You're recognizing and understanding your current situation as it is to free up the space to be able to move forward with your life. Another visual here that just talks about, radical acceptance in the sense of fully accepting something without judging it. So that's another thing that's difficult, especially in certain situations, is it can be easy to judge the situation. And so in the very beginning, I said it's non-judgmental awareness of the present. And so, trying to think of an example, I so much of this work is with trauma. So, when we're talking about childhood trauma, that's something that's very easy to judge. And again, it doesn't mean that you have to like it, accept it, approve, anything like that. But when we start getting into judgmental terms, it's getting away from acceptance. We just want to accept the facts and then we can process the emotions and the judgments of it later, but this is separate. So accepting the facts as they are without necessarily judging it, or trying to force it to change. So this is more in the present moment with the illness, health. You're not trying to force it to change at that moment. You're just trying to accept it, and then you can decide how you're going to proceed. Things that could be difficult to accept. It can be a situation, a memory, an emotion. There's no shortage of things that are difficult to accept. I think we got to a lot of this already, but emotions that get in the way, intense anger at someone or something, guilt or shame about something that you did, or just rage at the injustice of a situation. The prison example, of course, someone would feel incredibly angry at the situation, at the injustice of it. But that doesn't mean they can't accept it. They can feel this rage and injustice and they can try to accept it. Here, I like this saying, if you hated the color blue, you would still accept that the sky is just blue. Doesn't change because you like it or dislike it. Okay, and so let's talk specifically about the skills for practicing this acceptance. So I'm going to quickly try to go through some of this, but the first step here is to observe that you're questioning or fighting reality. And so you have to notice that it's happening in the first place before you start practicing this accepting standpoint. So, you know, cues might be like thinking it shouldn't be this way, or, you know, this isn't fair. You know, I guess noticing that in some way you're trying to deny reality is what it is. And so the next step, once you're able to recognize that, is to remind yourself that the unpleasant reality is what it is and cannot be changed right now. So this is what happened. I'm dealing with this illness right now. You know, this is what it is. And then using accepting self-talk. So I have some examples over here of some coping statements that you can try, you know, when you find yourself feeling like you can't accept something. You know, this is how it has to be. Everything that happened in the past has led up to now. I can't change what's already happened. There's no point in fighting the past. I can survive the present, even if I don't like what's happening. I don't have control over the past. The present is exactly what it should be given what's happened before. So again, those causes, you know, there are causes, even if we don't know them, to certain situations. And so finding some sort of accepting self-talk to talk yourself through this can be helpful. Reconnecting yourself to the present moment as it is by noticing what's going on around you, sensations in your body, being more aware of what's going on in that present moment. If you look up mindfulness, and I think I've even done some webinars about this in the past, there's no shortage of skills that you can use to connect yourself to the present moment, which is mindfulness. And then engaging in behaviors you would do if you already accepted the facts, or if you did accept the facts. So they call this opposite action. So basically acting in a way that even if you don't feel like you've fully accepted it, acting like you have. It can actually help you get closer to acceptance. So, you know, if you're fighting the reality of an illness, you know, you might, you know, regardless of how you feel physically, you know, just emotionally, you might want to stay in. You might want to stay on the couch, stay in bed, avoid doing things with other people. But if you're trying to practice acceptance, it would be doing the opposite of that, you know, spending time with family, getting out of bed, trying to do a little something, you know, acting as if you've already accepted where you're at and you're just going to move forward with your life as you can in that moment. You don't want to ignore disappointment, sadness, grief that might arise with some of this. You want to allow it to happen and then attend to any body sensations that occur. So, you know, you might, if you're really upset, trying to calm your breathing, you know, relaxing your muscles. Simple things like, okay, are my shoulders hunched? Lower them. Is my jaw tight? Release the tension. Drop the tip of your tongue from the roof of your mouth. Simple things like that can slow those body reactions that are happening when you get worked up. And then acknowledging that life can be worth living, again, even with pain. You can lean into that life that you want to live. You might not be able to do things the same way, given the reality of certain situations, but that doesn't mean that you can't live some of your values still. For instance, maybe you value nature, you know, and maybe if you have certain physical limitations, you can't do big hikes anymore. But you can still do some things with nature. You can sit outside at the very least, maybe go on a short walk, go for a drive in you know, a pretty area, something like that. There's still ways to connect with nature. It just might look different. And so acknowledging that you can still build this life, it just might look a little bit different. Some other tips for accepting, you know, accept what reality is, acknowledge it, figure out what you can control and what you can't. So, you know, with, like, for instance, with other people's behavior, once you know that, okay, I can't control what this person does, you can accept it. You know, you can accept that and you can move forward with it versus trying to really exert this control over something that can't be controlled. And I think we've covered those other points. So the last skill within the acceptance framework that we can talk about is turning the mind. So this is a specific skill within kind of this radical acceptance framework that's similar to some of the last slide that I talked about, but it's a nice visual. If you picture literally turning your head, is like making a choice to accept something. So like I said before, acceptance is choosing to accept. So you have to choose this over and over and over. Sometimes acceptance only lasts a moment or two. So you have to turn your mind, so to speak, back to acceptance. The more painful, the longer it's going to take to work towards this acceptance. So turning the mind is turning back to acceptance, maybe over and over and over again. And so the first step is to observe that you're not accepting. That's always the first step, is to acknowledge that it's happening and not judging yourself for that, not beating yourself up, but just recognizing, okay, I'm having trouble accepting this. Some cues for that are if you're feeling angry, bitter, annoyed, you find yourself avoiding emotions a lot, you might not be accepting a certain situation. Things like, why me? Why is this happening? I can't stand this. It shouldn't be this way. Again, might be hints that you're not in an accepting standpoint. If you start thinking about your health and how it's, so unfair, so, so miserable, this isn't how it should be. This isn't what you planned for your life. You might feel angry, you might feel bitter, you might feel some of these uncomfortable emotions, and you might have a reflex to deny that reality, to try not to focus on it, or to try to, in some extreme situations, avoid doctors, avoid appointments, just not think about it. That's not accepting. That's observing that that's happening is going to be the first step towards accepting it. With this turning the mind, an important thing is to make a commitment to yourself to accept reality as it is right now, or as it has happened in the past. So it doesn't mean that you have to accept this right away. It's a commitment that you're going to work towards this. So a commitment to yourself, finding like some sort of relevant way to remind yourself to accept this reality. How can you remind yourself of this commitment? You really have to come up with something that's relevant to you or why it's important to you to make that commitment. And then do it over and over and over again. I wish there was a simple fix for, okay, now I've accepted this. But oftentimes, like I said, it's this posture that you're trying to come back to, not this stance that you're trying to maintain. So it says here, keep turning your mind to acceptance when you come to this fork in the road where you can reject reality or accept it. So sometimes you might have to do this many times in a minute or many times in a day. And, an example I was thinking of when I was putting this together is, I don't know how many times I've done this, but I lose something. Like, I'm trying to think of I lose a lot of things. So the last thing I lost was probably my keys or something. But I looked in one place, probably my purse, and it wasn't there. And I'm like, okay, accepting my keys are not in my purse. Let's look elsewhere. But after I look a few other places, pretty soon I start like questioning, are they really not in my purse? I'm not really accepting that anymore. I go back to my purse. They're not there. Okay, now I got to accept that, move on. And that might happen again and again, a few times before I really get the notion in my head, okay, these keys are not in my purse. And it takes me a few times to get there, but I keep working on it. I keep looking there, and then it's like, okay, a reminder, I got to look somewhere else. And so that kind of example can be true to a lot of things in life, though, in less mundane ways. But, where you come up to something, you accept it, you move on a bit, and then you find yourself going right back towards that non-acceptance. And so you have to remind yourself again, move past it. You might slingshot back. So it can take a lot of effort to keep turning the mind. And again, the bigger something is, the more you're going to have to work on this. And then the last step is to make note of ways that you can catch yourself in the future when you drift out of acceptance. So there might be little cues where you start to recognize, okay, this is when things start to get really hard for me to accept. So when I feel really angry about a situation, about someone else's response. That might be, something to pinpoint of, okay, this might be, a chance when I'm going to drift out of that acceptance. Everyone will have slightly different triggers, but you can start to make notes of ways when you're going to drift out of that acceptance, so you can start turning towards that acceptance sooner. Okay, so I want to leave time, and I went on way longer than I thought, so I want to leave time for some questions or comments. Yeah, I see some in the Q&A, so I'm happy to answer those.
Sure. Let's start with the first. Could you please provide the steps to acceptance, as there are many? I think they're summarized in your presentation as well, right?
I think so. Yeah, I think I talked about some of these steps, of ways that you can practice the acceptance. Maybe the question was before I talked about the steps, but if there's something that's not clear, maybe that person could just type it in the chat or the Q&A and I can answer.
Sure, that would be great. That would be helpful. How do you react to people who who do not accept reality? And is it your place to offer advice?
That's a tough one. I think it really depends on your relationship with the other person, and what the situation is. So, if this is someone really close to you in your life, where you have, a close connection and you can bring up these challenging conversations, yeah, maybe it's worth sharing, something that you learned and something that might be helpful for them. But as you get into more painful topics, it gets very, very tricky. Again, I keep coming back to this, but like childhood sexual abuse, like that's going to be something really hard to talk to someone about accepting. So I think, again, it depends on the situation, and, there's ways you can maybe suggest or talk about this without directly saying like, you need to accept this. Sometimes just sharing from a standpoint of, oh, listen to what I learned. I found this really helpful, and they can draw their own lines. Or even just suggesting that someone might need to connect with a therapist. Like, hey, have you thought about processing this with someone? Yeah, depends. I hate that answer, but I think there's some different ways you can handle it.
The cause of my illness is that the bacteria that make me sick are everywhere in my environment. This just makes me more anxious, and I feel like I have no control.
Yeah, and so I think that's something that would be beneficial to try to accept is, there's bacteria in the environment, and it has the possibility of making you sick. So that doesn't mean that you have to just welcome the bacteria and put yourself into situations where you might be more exposed to certain bacteria, but recognizing that it's a possibility and it's something that you might be susceptible to. Well, now you can start, if you accept that, you can start making changes, maybe how you take extra precautions or who you need to talk to. If that's the anxiety piece of it, what can you do to address that anxiety? Maybe it's not a situation you can control or change, but your reaction sometimes is what you can change.
And somebody has made a comment, this person saying, for me, acceptance would be easier if this disease resulted as a consequence of or punishment for my actions.
Yeah, so I imagine like, trying to think, like my uncle died of cancer, and he was the healthiest guy I knew. Like there was no reason he should have had cancer, from a behavioral standpoint. There was no action that, that should have resulted from. So it can be harder when you're trying to find cause for something that doesn't have a clear cause, but even something as simple as knowing, okay, maybe it's not a behavior or something that you did that's a punishment. Maybe it's genetics. Maybe it's the bacteria in the environment. Maybe there's certain causes that could be less obvious, but just knowing, okay, this is happening for some reason, even if I don't understand it, can free up some of that power for acceptance.
I think that's probably very helpful advice.
Yeah.
Okay, I don't see any other open questions in the queue, so I'm going to give everybody just one last chance. If you have one more question, just drop it in there. But I want to thank you again, Devin, for joining us. I think these webinars are very, oh, wait, here we go. We have another one. I find myself constantly apologizing to family and friends because I am not up to doing something. I feel I am accepting my reality, but they are not and do not want to, no matter how I explain my illness. NTM is not easy to explain, and we could grow tired of trying to. Do you have any suggestions?
Yeah. So another situation where it's tricky without knowing the full situation, but I think that there's different love. So checking the facts, I think, is step one. Like what are they wanting you to do and what can't you do? And what are the limitations and how can you maybe modify certain things to maybe do certain things with family or friends? Sometimes what can happen is people accept a reality of I can't do anything, which can lead to depression, sadness, anxiety, versus I can't do things the way I used to. Those are two very different things to accept. So that's part one of that. The other part is, I think that explaining to friends and family that, you're not able to do something and, you wish you could, but you can't. I think sometimes people feel that they owe a lot of explanation and, you're allowed to say no to something and just say no. You don't owe anyone an explanation. And so if someone's, fighting with you, arguing with you, trying to get you to do something that you just cannot do, I think just knowing that you have boundaries and it's okay to have those boundaries and you don't have to have an explanation for it. It's accepting their response and accepting your right of how to respond to that response.
And I want to run a couple of things by you because this is something that, when Fern was alive, my late stepmom, this is something that she had to deal with sometimes. And first of all, we have a really good pamphlet that explains, what patients are dealing with. And it's called Insight, A Patient's Perspective. And sometimes patients will actually order copies to give to their friends and family to say, you need to understand what it is I'm dealing with. And this pamphlet explains a lot. But, you need to look at this so that you understand what I'm having to deal with. So if you want to order those, you can contact us and they're free. We are happy to send them to you. And the other thing is, there were a couple of times where I or another family member would have to say, Fern's just not up to doing this. And it was frustrating for other people sometimes. And we had to explain she's on, X number of antibiotics. She takes this many drugs every day. This is a significant treatment protocol. And you wouldn't tell somebody who's, for example, being treated for cancer that, well, this is inconvenient. Why can't you do this? So you need to have the same kind of understanding and acceptance for somebody else who's dealing with a serious chronic disease. And that's for us, we found that to be a more effective answer because it usually just shuts them down. Like, you can't just say something like, well, why can't you just be better? Because that's just not how it works.
Mm-hmm. I think it's a really good point, Amy, that like it's not on you as a patient to educate everyone. There's some level of effort that someone else needs to put in. So I think getting a pamphlet and asking them to read it is a really good, because if you have to educate everyone and provide, that's a lot of extra burden on you.
Yeah, it is a huge extra burden, and we're happy to help you take some of that burden off by giving you copies of those pamphlets. So you can always contact us by phone or email, and I'll type the email address into the responses below so you can find out how to answer. But we are happy to give you as many as you need. And yeah, I think and then you give them that pamphlet. If they're not going to look at it, if they're not going to take at least a little bit of their time to try and understand what you're going through, then they may not end up being a core part of your support network.
Mm-hmm.
And that's something that you may have to deal with at some point, but some of them may come to understand what it is that you're dealing with.
Yeah.
Next question. When does one shift from accepting pain to avoid suffering versus acknowledging pain on a path that may require palliative care?
I'm thinking through that. So accepting pain
to avoid suffering versus
Yes.
acknowledging pain on a path that may require palliative care?
I might be misunderstanding the question, but I almost feel like they're two versions of the same thing, whereas one is accepting pain and then one is accepting and acknowledging and moving towards something. So I almost, and again, I could be misunderstanding it, so please feel free to type in a clarification. But I think, once you're able to accept something, you're able to move towards something else. And if that's palliative care, if that's, whatever support or treatment or intervention that might be, once you accept the pain, you're able to move hopefully towards some sort of next step.
Okay. Somebody has written in, oh, hang on, there's a clarification. To clarify, it was lean into that life versus leaning into the acceptance of your impending death, I guess. Leaning into a life of pain. I guess for every patient, it's a different threshold. It's a decision you have to make, right?
I think so. And I think also looking at, like when I talked about, there's certain limitations and certain expectations and probabilities, but trying to stay realistic with it. And so, if the reality is, the survival rate of something is, very, very low, then I think leaning into accepting death is probably the most important aspect of that. There's a very high survival rate and, there's pain involved with it. But maybe there's a life worth living even with that pain. That's a different story. So I think you also have to look at the reality of the situation and the probabilities, if that makes sense.
Yeah. So here's another question, and I think I might be able to feel this one. I have recently been diagnosed. My doctor put me on antibiotics right away. Is this advisable? I've joined a Facebook group for support. Some people are saying that I should have used other methods first. I think those people, they're not your doctor. They don't have access to your information. They shouldn't be deciding what your treatment protocol is. That is up to, that's a discussion between you and your doctor to decide what takes place. Having said that, if you want to get a second opinion from another doctor, that's your right as a patient, and you should. The decision to put somebody on antibiotics right away versus waiting to see how the disease progresses depends on where the patient is in their disease. If they have disease that looks like it's already progressed and maybe damaging their lungs, a doctor might be more inclined to put them on antibiotics, start them on treatment sooner. Versus if it looks like there's, some moderate, bronchiectasis and it looks like it's something they can keep an eye on and it's not progressing necessarily, they may do what's called watchful waiting. In any event, whether you're on treatment or not, we very strongly recommend that you do airway clearance every day. So if your doctor has not prescribed airway clearance for you, go back to your doctor and say, I would like to do daily airway clearance. Please, prescribe this for me, prescribe a device for me, and, get me to a respiratory therapist to show me how to do proper airway clearance. And there's lots of information on that. I would also recommend joining NTM Connect, which is our online support forum. You can join it. You can go to our website, ntminfo.org, and in the upper right corner, there's a button to click on it and you can sign up for it. You'll register for it. It's a secure online forum for patients only, and it's a really good, very active community. And we also have a lot of online support groups going on. So you can email us, and I will drop the email address into the answers here, but the email address is ntmmail@ntminfo.org if you want to ask about joining an online support group. They're wonderful. It's a lot of patients who have a lot of valuable information to share. But I can't say for certain whether these patients who are saying you should have tried other methods first, I don't know that they're right or not right. It could be that what they're saying is you should definitely be doing airway clearance as well if you're not already. In which case, I would say definitely, we always recommend airway clearance. Whether you're on antibiotics or not, you should be doing airway clearance. It's very important. We believe it's crucial. So I hope that helps.
Yeah, and I think, like you said, Amy, asking questions to your medical team is really important. I feel like sometimes people feel like they don't want to ask why or don't want to, question someone. But I think a lot of medical doctors or providers welcome, someone trying to understand rationale behind something.
Correct. Yeah. Once again, to join NTM Connect, you can just log on to ntminfo.org, and in the top right corner, there's a button that'll connect you to our NTM Connect site, and you register, and then you can get started on our online community. And NTM mail at ntminfo.org is the email address that you would contact for information on support groups. And information on getting pamphlets, and we will be happy to send those to you and connect you to an online support group that you can join. I don't see any other questions, so if we don't have any others, we just have a comment. Thanks to for pushing us to do our airway clearance, so important. I have to force myself to do it, make excuses all the time. And I understand that. I feel the same way about doing exercise, and yet there I am pushing myself to go to Pilates class because my doctor has told me it's important. So I understand completely. Yes, airway clearance is very important. We encourage you to do that as much as you're able to, and as much as your doctor tells you to. Devin, thank you again. This was wonderful.
Yeah.
It was a great webinar. Everyone, thank you for joining us. And we look forward to seeing you again in November, and we will be soon announcing a nutrition webinar in October. So Amy, are there any evening support groups? I've yet to find one I can attend, as they seem to be during the day. Thank you for that feedback. We will actually take that feedback back to our support group leaders and find out if we can organize an evening support group. Thank you for letting us know about that. That was very helpful. Everyone have a wonderful evening. Have a great rest of the week, and we will see you soon.
Bye, everyone.